Disclaimer, this instructional tool is created to enable students to develop their test-taking skills. The question or questions and answers contained in this instructional video were patterned after the official publicly accessed samples from the RN test plan of the National Council of State Boards of Nursing, or NCSBN. The discussions and rationale presented in the video are based on the lecturer's research and are meant to provide an explanation for the answer or answers to the question or questions that is or are presented. The lecturer makes no claim, directly, implied, or otherwise, that the rationale discussed is officially endorsed by NCSBN. Okay, good day, learners. This time we're going to talk about Rhogam and how it would actually help prevent RH incompatibility. So I'm not crying. Okay, let's begin the discussion with the sample question. Is Rhogam a necessary treatment for a patient with threatened abortion? Okay, that's a question. It should give us a sense of direction. Before we do that, before we answer the question, let's recall some concepts related to Rhogam and RH incompatibility. Okay, so it's essential that we have a working knowledge on the blood types of the patient as well as which blood type would be compatible. As we all know, blood type O is the universal donor, okay? And blood type AB is actually the universal recipient. A patient with a blood type A could be compatible with a blood type A or a blood type O. Patient with blood type B could be given either blood type B or blood type O. A patient with blood type AB could be given blood type A, blood type B, blood type AB, and blood type O, whereas a blood type O should only be given a blood type O blood. Okay? Now, what about the RH status of the patient? An RH positive blood can only be combined with an RH positive or an RH negative blood. So in essence, when you are RH positive, you could be given RH positive or RH negative blood. However, if your RH status is RH negative, you should only be given an RH negative blood, okay? Now, let's play with this concept. Therefore, if the mother has an RH positive blood and the father has an RH positive blood and the baby is RH negative, there's no problem at all because their blood types are compatible. Okay? Now, what about if the mother is RH positive and the father is RH negative and the baby turned out to be RH negative? Still, there's no problem because the mother has an RH positive blood. If during the delivery it gets mixed with an RH negative blood, there's no problem at all because as we said a while back, a patient with an RH positive blood, okay, can be mixed with the blood coming from an RH positive and an RH negative patient. Okay, now what about if the mother is RH negative and the father is RH positive? So chances are the baby becomes RH positive. So if the father and the baby are RH positive and the mother is RH negative, is there a problem? Yes. Why? As we said a while back, when the mother has an RH negative blood, should only be mixed with an RH negative blood. While the mother is carrying the baby for 9 months, theoretically speaking, there is no actual mixture of maternal and fetal blood. However, during the delivery process, with the separation of the placenta, the baby's blood gets mixed with the mother's blood, such that since the baby has an RH positive blood, it reacts with the mother's RH negative blood. And we call that condition RH incompatibility. Therefore, okay, RH incompatibility exists when the mother is RH negative and the baby is RH positive. Now, if you're listening to how we were discussing the concept a while back, it seemed to me, okay, that the RH status of the baby is directly derived from the RH status of the father, right? Since the father is RH positive, then the baby is RH positive, such that what happens if the mother is RH negative and then the father is RH negative? Do you think we would still have a problem? when both the mother and the father are both Rh negative. Okay, the answer? If the baby turns out to be Rh positive, yes, the couple will have a problem. Okay, because there could be high possibility that the baby is not okay, the child of the father, because usually the Rh status of the baby follows that of the father. I said usually, not in all cases. Okay, that's just a joke. Okay, anyway, let's move on. Here's a functional concept, my favorite. Okay, this is actually unique to the Gapuz review system. So Rh incompatibility develops when the mother is Rh negative and the baby is Rh positive. Okay, so here's a sample question. Which of the following blood types can be administered to a client with an Rh positive type AB blood? So let's recall, a patient with AB blood could be the universal recipient. The patient could receive blood type A, B, AB, and O. However, let's also recall the Rh status of the patient. If the patient has an Rh positive status, take note, their blood could be mixed with both Rh positive and Rh negative status, okay? So here we go. So since this patient could receive all types of blood, whether positive or negative, so let's figure things out. Let's take a look at the option. A, Rh negative type A, yes. B, Rh positive type A, yes. C, Rh negative type B, yes. D, Rh positive type B, yes. And E, Rh positive type O, yes. So everything could be actually given to this patient. So once again, we made use of the check framework. We tried to figure out, once again, to recall concepts related to the drug, Rhogam, let's use the check framework. So let's begin with the classification of the drug, how to evaluate the effects of the drug, exactly what time is best to administer the drug, client teaching related to the drug, and keys to safe administration of the drug. Okay, so let's use that. So your Rhogam is an anti-Rh medication, so it helps prevent Rh incompatibility if it is given within 72 hours after the delivery of an Rh positive baby from an Rh negative mother. Okay, so it's given in Rh negative women with Rh positive babies. So how will we know that it's effective? Prevention of Rh immunization. So it could also be given as early as 28 weeks of pregnancy or at 72 hours after the delivery of an Rh positive baby. Okay, it is not indicated in patients with anaphylactic reaction to Rhogam, but it is indicated in cases where there is transfusion of Rh incompatible blood. So in cases where there is abortion or threatened abortion, or there is antepartum fetal maternal hemorrhage like placenta previa, or when there is a tendency that the mother, okay, would experience bleeding. And then pregnancy or delivery of an Rh positive baby, ectopic pregnancy, and it should also be given if the patient undergoes diagnostic procedures like amniocentesis, chorionic villi sampling, or percutaneous umbilical cord blood sampling where there is a chance that bleeding may occur. So remember the code here for the indication of Rhogam, tape. Okay? Okay. Having said that now, you also have to remember that your Rhogam is administered IM only to the mother. It is not injected to the newborn infant. It's not for the baby, it's for the mother, because what is now being prevented is the development of Rh incompatibility for the next pregnancy. Remember, the first pregnancy is usually safe because the mixture of maternal and fetal blood occurs at the separation of the placenta during delivery. Okay, so it's only in that specific period of time that Rh incompatibility could develop. Okay, so the first child is usually safe. So Rhogam is being administered for the prevention of Rh incompatibility to the next pregnancy or the succeeding pregnancies thereafter. Okay, so to answer the question, is Rhogam a necessary treatment for a patient with threatened abortion? Yes, because in threatened abortion, bleeding may occur. Okay, so once again, it's shout out time. Congratulations to a lady, May Ann Rose and Kita USRN, who passed the NCLEX RN for the State Board of New Mexico last June 23, 2020. And she hails from Columbus City, Laguna, and she did our classes in RA Gapuz, Manila. From your RA Gapuz family, thank you so much for keeping your focus for the NCLEX. And despite the current pandemic, it never stopped you from fulfilling what needs to be done, such that after this pandemic is over, all you have to do is to, jump the gun, fly the jet, and go to America to fulfill your great American dreams. Congratulations, May Ann, Rose, and Keita, from your RA Gapuz family. So let's learn together. For more instructional videos, subscribe to our YouTube channel, Gapuz Mentors, and my Facebook page, Mentor Ray.